In this video by Deckplate we will get information about VA rating for renal dysfunction, voiding dysfunction, urinary frequency, obstructed voiding and urinary tract infection. Disclaimer: this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. Veterans suffering from renal and urinary conditions are entitled to disability benefits based on the severity and impact of their conditions. The VA assigns specific ratings to these conditions to determine the level of benefits. Renal dysfunction. Renal dysfunction, or chronic kidney disease, is rated based on the glomerular filtration rate, GFR, which measures kidney function. 100% rating. Chronic kidney disease with a GFR less than 15 milliliters per minute per 1.73 square meters for at least 3 consecutive months in the past 12 months, requiring regular dialysis, or being an eligible kidney transplant recipient. 80% rating. Chronic kidney disease with a GFR from 15 to 29 milliliters per minute per 1.73 square meters for at least 3 consecutive months in the past 12 months. 60% rating. Chronic kidney disease with a GFR from 30 to 44 milliliters per minute per 1.73 square meters for at least 3 consecutive months in the past 12 months. 30% rating. Chronic kidney disease with a GFR from 45 to 59 milliliters per minute per 1.73 square meters for at least 3 consecutive months in the past 12 months. 0% rating. GFR from 60 to 89 milliliters per minute per 1.73 square meters in either recurrent RBC casts, WBC casts, or granular casts for at least 3 consecutive months in the past 12 months. Structural kidney abnormalities, cystic, obstructive, or glomerular, or an albumin to creatinine ratio, ACR, greater than or equal to 30 mg per gram for at least 3 consecutive months in the past 12 months. Voiding dysfunction. Voiding dysfunction includes conditions like urine leakage, urinary incontinence, and stress incontinence, rated based on the severity of the condition. 60% rating, requiring the use of an appliance or absorbent materials changed more than 4 times per day. 40% rating, requiring absorbent materials changed 2 to 4 times per day. 20% rating, requiring absorbent materials changed less than 2 times per day. Urinary frequency. Urinary frequency is rated based on how often a person needs to void during the day and night. 40% rating. Daytime voiding interval less than 1 hour, or awakening to void 5 or more times per night. 20% rating, daytime voiding interval between 1 and 2 hours, or awakening to void 3 to 4 times per night. 10% rating, daytime voiding interval between 2 and 3 hours, or awakening to void 2 times per night. Obstructed voiding. Obstructed voiding involves difficulty in voiding due to blockage or other issues. 30% rating, urinary retention requiring intermittent or continuous catheterization. 10% rating, marked obstructive symptomatology, hesitancy, slow or weak stream, decreased force of stream, with 1. Post-void residuals greater than 150 cubic centimeters. 2. Uroflowmetry showing markedly diminished peak flow rate, less than 10 cubic centimeters per second. 3. Recurrent urinary tract infections secondary to obstruction. 4. Stricture disease requiring periodic dilatation every 2 to 3 months. 0% rating, obstructive symptomatology requiring dilatation 1 to 2 times per year. Urinary tract infection. Urinary tract infections are rated based on the frequency and severity of infections and their impact on renal function. 30% rating, recurrent symptomatic infection requiring drainage by stent or nephrostomy tube, more than 2 hospitalizations per year, or continuous intensive management. 10% rating, recurrent symptomatic infection requiring 1 to 2 hospitalizations per year or suppressive drug therapy lasting 6 months or longer. 0% rating, recurrent symptomatic infection not requiring hospitalization but requiring suppressive drug therapy for less than 6 months. Understanding these ratings helps veterans know what to expect and ensures they receive the benefits they deserve. Thank you for watching this video. Please don't forget to subscribe and like our videos.